Tiffany, and I'm a physical therapist assistant here at Optimal Physical Therapy. Today I have Ginger with me, and we're just kind of talking about her history with aquatic exercise and how she's progressed with it. Ginger originally started coming to therapy for knee and hip pain, and we introduced her to the pool, and it was much easier for her to move in there. Right?
Absolutely,
Yeah.
absolutely.
So briefly, why don't you just tell us how aquatic therapy has helped you?
Actually, it was 2 weeks. It was 2 weeks down the line. I was really feeling it. Actually, one week I could feel it, but 2 weeks it was pretty much gone away. So
Awesome.
so that I can have great mobility.
And then how often are you're working out on your own in the pool now?
I work out in the pool 3 days a week, and that has been beneficial. And the days that I miss, I can tell. If I go 3 or 4 days, I can always tell.
So other than a decrease in your pain, what have you noticed throughout your daily routine that you're able to complete now that you're feeling better?
Well, my daily routine has improved in much improved in balance, and still, just putting your pants on, your shoes on, and all that. I don't have to hold on to things as much anymore, and I can, have freer. How do I say that? I'm just able to do that, and then also my gardening. I'm a gardener, and I've been able to bend down better to pick up weeds, and do the planting and things that I couldn't do so well before.
Yeah.
I was doing it, but it was doing it with pain and doing it with less mobility.
What kind of exercises do you do?
What types of exercises do you complete in the pool?
Well, we have a series of exercises that I do. I use the weights. We use weights underwater, and pumping the arms up and down, so that helps with your arms. And then something called cross-country skiing, where you're skiing like this, so you're getting a lot of stretching going on. Planking, good stretching with planking, and then good arm exercises over the head, swinging the weights above the head,
Right.
so that we're getting good exercise overall.
Yeah, so a lot of what Ginger does in the pool, she uses the water for resistance, but you're also able to use dumbbells, water dumbbells in the pool for added resistance. And then as she was talking about the cross-country skiing motion, really is good for core stabilization and improvement in gait or ambulation on land as well.
Well, I might add that once I did my water exercises, then working out on land was much easier, where I could walk more distance without having any pain, more endurance to be able to withstand a 30-minute walk without having to get tired.
Right.
Just get tired. So
Good.
that, and then, like I said, the bending and all that, and the cardiovascular, of course. Then I wasn't out of breath because I could walk further without heavy breathing.
Able to complete more throughout the day at
Correct.
one time.
Correct.
Did you have trouble getting started on a land exercise program because of your pain prior to being introduced to pool?
Well, I didn't actually have trouble getting started. I just didn't do it as much because it wasn't comfortable. So I have a dog, and I was walking the dog, and I couldn't walk as many miles that I wanted to with her. And this way I can do more things with her, and
It's rewarding.
yeah, it's rewarding.
Yeah.
Well, the doctor told me that I should lose weight and I should be more mobile because number one, my cholesterol was up. That was something that I needed to work on. And so once I did the water exercise, I found that exercise on land was just so much easier to do that in everyday chores. That's the gist of it, and I feel better all over, and I've had great results now over the years. I just had a physical last week, and everything was great. So
Using that transition from ease of movement.
I did lose 30 pounds. I'm kind of staying there. I know that if I could get off the stuff that I eat, I could lose more, but I can stay steady with working out all the time.
Right.
So I don't have to if I don't want to.